health care costs. My gosh, there's been some stunning new studies coming out saying that some hospitals mark up their treatments by as much as 1,000%. Didn't say 100%, 1,000%. There's a hospital down in my neck of the woods over in Pensacola, Florida, charges its uninsured and out-of-network patients 12.6 times what Medicare allows them. That's a huge, huge markup in terms of cost. Is it the system? What's going on? Well, we've got some of these medical questions. We rely on an old friend who's been on our show before. Dr. James Pinckney is with the Diamond Luxury Healthcare Center. He's the founder and CEO out of Dallas, Texas. Hey, Dr. James, glad you joined us this morning.
Hey, good morning.
Doc, what's going on when you see, I don't know if you saw that report, but there are not just one, but many, many hospitals that mark up treatments by 1,000% and charge many times over the Medicare costs. Is this indicative of the system itself? I want to get into how you handle this, but as far as the big picture, why are these charges so high over, say, the Medicare level? I know maybe the Medicare, what senior citizens get from the federal government reimbursement, maybe doesn't meet all the costs, but do you mark it up 12.5 times?
Yeah, Jim, that's a great question. And hospitals would contend that the Medicare and Medicaid reimbursements have not increased to match inflation. But you know what? Back in the 80s, about 1984, the charge-to-cost ratio was 1.35x. So hospitals were charging on average about 1.35 times Medicare reimbursements rate. And then in the late 80s, 90s, and early 2000s, managed care exploded, and we had this huge skyrocket in costs. And they went from about 1.35 to 3.3. And now hospitals in 2015 are charging 10x, 12.6x, which is absolutely ridiculous. Their margins are huge. They're making a lot of money. And unfortunately, it's at the expense of the American people. So we have to find a way to lower healthcare costs globally and drill down to the true cost of care, free market healthcare, price transparency, and reintroduce competition into the market.
Well, under the present, and I want to talk about that competition, but under the present system, doesn't the federal government carry a pretty big stick? Because I know that hospitals have to carry on a lot of uncompensated services. You got some poor person that walks in the door and they're very ill or have some life-threatening situation. You just can't turn your back on them, and so
right.
and so often hospitals don't get paid for that kind of thing. But in virtually every state I know of, there is some compensation from the legislature. Federal government builds in an uncompensated factor in there, and so. Are the regulators doing enough to control, when you see a hospital getting 12.5% return over the Medicare rate, it seems like they would have some kind of a stick to carry by saying, look, we're going to cut you off from Medicare, or we're not going to see you get the compensation for the uninsured care you're giving if you're going to charge over all that high rate. I mean, is that in the equation, or is that just something that the free market has to take care of?
Jim, it could be. Right now, Maryland is the only state that regulates hospital rates and says, hey, you can charge this price for a certain procedure. West Virginia does regulate rates as well. But you know what? We have 50 states. We should be regulating these prices. And I guarantee you, if a hospital had to charge a particular price, drill down to their true cost of care, and let them have a substantial margin, 2x, 2.5x, not 12x, then we could start lowering the cost of health care.
Well, no doubt about it. Well, I mean, and as you said, you've got nonprofits and you've got profits. If you're a for-profit hospital, you're out there taking a chance. You certainly need to get a return to your investors, to your stockholders, whatever happens to be. I'm not undermining the free market system as such, but it just seems like that those costs are just so overwhelming. I just didn't dream the markup. I knew there was markup, and I know that there is, again, a certain amount of care that has to be given where there is no compensation. That just seems out of line. Now, when you talk about the free, now let's talk about the free market now, and you're involved in this because in your clinic and you service a variety of needs of professionals. Now, do you take any insurance at all, or do you have alternative programs? How do you handle that? Now, more and more doctors are going to the fact that, they'll take compensation for major services, but for the basics, day in, day out services, they don't want to fool with, or not wanting to fool with it, they don't want the paperwork, so they say, no, you're going to pay us for those services, but we're not going to handle the insurance along those lines. But if you have a major medical policy, you'll come out ahead along those lines. Or the clinic charges you so much a month. They basically become an insurance provider by charging you so much. More like there get many and use normal premiums. You make it up in the long run. Saves you money, so many people tell me. I'll ask Dr. James some more questions about this. Freshen up your coffee, and we'll come right back on this Flag Day right after this message.
You're listening to Jim Brown's Common Sense, right here on the Genesis Communications Radio Network at GCNlive.com.
Usually, the older one gets, the less you are able to absorb amino acids and the less you are able to repair the 100 trillion cells of your body. As a result, you'll have less energy, your tissues will shrink, and you'll become wrinkled. An older person will typically injure more easily and heal more slowly. Not fun. However, if you can consume a protein powder that is easier to absorb, then you may be able to gain back some strength, muscle, and speed of recovery. One World Whey is a highly digestible whey protein powder that may be the perfect answer for you.
My name is Errol. I'm 74 years old. You know, the taste of One World Whey is amazing. I play pickleball, and since taking One World Whey and your trace mineral supplement, I have more energy and recover faster from my working out. I used to take another grass-fed whey protein powder, but now I'm getting much better results using One World Whey.
Call 888-988-3325. That's 888-988-3325. Or visit oneworldway.com.
If you're worried about your health, and you're tired of the nasty side effects of harsh drugs or antibiotics, then look no further. Supernatural Silver is the answer. Supernatural Silver is a powerful immune system enhancer that can be used every day to help keep you healthy and well with none of those nasty side effects. It's extremely safe for use internally as well as topically, and Supernatural Silver is hundreds of times more effective than colloidal or ionic silver. It is perfect for use in the sinuses, eyes, ears, and on any wound or skin issue. Supernatural Silver is also extremely effective when taken orally and can help fight off bacteria, viruses, and mold that may be overwhelming your immune system. Go to supernaturalsilver.com, supernaturalsilver.com, and use the promo code SILVER2015 for 30% off of your entire order, and give yourself and your loved ones a fighting chance with Supernatural Silver.
It's very easy to be a criminal. All you need to burglarize a home is one simple household tool, a pair of scissors. If your home security system can be compromised by a criminal using scissors, then you're making it easy for them. Almost every home security system, even those sold by big-name companies, has a weakness: the phone line. You shell out $1,500, get locked into a long-term contract, and think you're safe. But a burglar can destroy your alarm in seconds with one snip. And when a burglar cuts your phone line, you're defenseless. Simply Safe Home Security is the smarter choice. Built by Harvard engineers, Simply Safe uses a wireless connection to call the cops. Scissors can't cut it, and that means your home stays safe. 24/7 professional monitoring is under $15 a month with no contract. Simply Safe Home Security keeps you safer than the other guys for half the cost. Protect your home with the alarm you can trust. Simply Safe. Go to simplysafedefense.com now for an exclusive 10% offer. That's simplysafedefense.com.
Is negative content or comments on the web affecting your personal or professional reputation? Unfavorable comments, embarrassing pictures, videos, legal documents, and bad tweets can ruin your personal life, your career, or your business. It happens a lot, and it's just not fair. But what can you do? Reputation.com can protect your good name. Get a free consultation now at 800-831-0771. That's 800-831-0771. Call right now for a free expert reputation analysis. It's easy to squash the unfair attacks with our patented system, and the analysis is absolutely free. Make the best things about you jump out in searches. Protect your personal and professional reputation, your business, and your income. Get your free reputation analysis from Reputation.com right now. Call 800-831-0771. 800-831-0771. 800-831-0771.
Independently leading the way for the nation. Compelling talk for every political persuasion. We are GCN.
Welcome back to Jim Brown's Common Sense. Now, here's your host and professor of Thinkology, Jim Brown.
Back to our program. Great day out. Beautiful weather all over the country. You know summertime has gotten here when our listeners up in Fairbanks, Alaska, KFAR 660 AM, are seeing a high today of 76 degrees at the northernmost part of America here right now. You know it's got to be summertime. Talking about health care, the cost of health care have just gone up astronomically to where hospitals are marking their bills up over 1,000% to what they say cover the cost for the uninsured. And a number of clinics are taking alternative paths, taking a different direction to not take insurance but to charge you a much cheaper rate. Dr. James Pinckney is my guest. He's the founder of Diamond Luxury Care in Dallas, Texas. Dr. James has been on the show before. Doc, if you'll pick up on that conversation again. Now, let me ask you this. What about Medicare? You don't take any Medicare if someone, say, 75 or 80 and that they are on Medicare. You don't take any Medicare at all in your practice?
No, sir. We don't accept any government payers or any standard insurance. Now, we do provide invoices, and our clients can ping deductibles they like on their own, just like then in the 70s and 80s before this managed care revolution hit our healthcare system. But we don't take any insurance at our program because insurance should not be used for the day-to-day maintenance of health. It's too expensive. Insurance is a risk mitigation tool. It should be used for catastrophic instances, surgeries, cancer treatment, hospitalization. That's where insurance should be used. It It should not be used in the primary care setting. It should be used just like your car insurance, your your home insurance, Jim. When you fill up your car with gas, you swipe a credit card. You do not file an insurance claim. When you need new windshield wipers, your tires rotated, an oil change, that is prevention on your car. You pay cash, and that's why your insurance premiums are low. If you get in a car accident, it costs thousands of dollars to fix. You file an insurance claim, you pay your deductible, and that is how we should use insurance on all aspects, for medical insurance as well.
So as I understand correctly, then someone, instead of buying the expensive insurance where you just pay a $25 deductible or something, then the alternative plan would be for me to carry a major medical policy for something catastrophic over $5,000, $10,000, something like that. I would have insurance to cover. And then as far as the normal care coming in and out, I could afford that under your plan, because I would be paying a much less premium rate, and then I would have the money to cover those expenses that are paid out of my pockets. In other words, things, as you mentioned, the x-rays and the normal wear and tear factors that you pay for medical care today. Is that right?
That's right. Let me tell you a little secret, Jim. 93% of people do not hit their deductible of $6,000 or more. Insurance companies know that, and that's why insurance premiums are on the rise. We have got to be smart about the way we deliver health care.
You also mentioned Medicare, and I would tell you this as a personal example. I had to be fitted for some insoles. I've got some foot problems. I'm a real big guy. I'm 6'3", and I weigh, dropped down actually by hard work, about 190 pounds. But I've got AAA narrow feet. And all this big body and these very narrow feet as I get older has caused me some problems. I had some insoles made. The clinic said they don't file for the insurance, but they gave me the form, just as you're suggesting. I sent the form into Medicare, and Medicare didn't reimburse me for all of it, but about 80% of it, they sent me a check back. It was a couple of months later. So it's not so unreasonable to say that on some of the care that you would charge for, that someone over 65 who's on Medicare could get reimbursed for it. And I'm an example of that. I got reimbursed even though the clinic took my payment, and in fact they even told me we're not sure yet that Medicare even covers this. And I took a chance and sent it in, but lo and behold, they sent me a check. So right. You can even use Medicare as you get older, even in a clinic situation like yours, is the point I want to make.
Absolutely. And then one more point. We also can use health savings accounts or flex spending accounts to pay for our services. You can use pre-tax money to really accentuate your health care. And I want everyone to understand that this is an adjunct to catastrophic insurance. We want people to have catastrophic insurance plans, so we're not anti-insurance. I just want to take away all the complication and the convoluted pathways in managed care and drill down to the true cost of care. If we can do that, we have a chance at saving our system.
Now, so it would take to really make this work then, hopefully the company, if you work for a company, that company, rather than offering you an insurance plan per se, they do better to write you a check for what the average cost is to go into your health plan, or help you set up a health savings account, right? So that you could pay for it that way, because companies are just...
We can take that even a step further. So we have a plan called our Diamond Solutions Plan, where we partner with corporations, small businesses, large businesses, it doesn't matter. And we couple our direct medicine services with a catastrophic insurance plan. So it works perfectly if you're partially self-insured or fully self-insured. But if you're a small company and you've got 3, 4, 5 employees, then we can help you transition to a catastrophic plan for all your employees and then pay $145 a month. Doesn't matter age, doesn't matter pre-medical conditions, and give your staff a concierge doctor on call 24 hours a day, all the discounts that we offer, the amazing service. It's an unbelievable plan that saves a ton of money. We're actually saving about 27 to 35% off the bottom line of healthcare expenditures, and that is a revolution that's also spreading across the country. There's some direct medicine groups in Seattle, in the Northeast, as well as here in where I am, Diamond Physicians, that are really saving corporations a lot of money.
Well, it looks like that's the wave of the future, and particularly if you're outraged over what you're paying and want to get a handle on it, particularly if you're by yourself out there shopping for insurance. I'm just trying to make the point there are some alternatives, and Dr. James has an awfully solid alternative that I think makes sense. We're going to see more and more of that here in the future. Hey, Dr. James, thanks for spending some of your weekend day with us. Your website is diamondphysicians.com, www.diamondphysicians.com. If my listeners misplaced that, you can go to my website at JimBrownUSA.com, and I've got all the information about Dr. James on that. Dr. James, take care. Have a nice weekend. I hope to talk to you again soon.
Hey, thanks, Jim. Hopefully we'll be in your neck of the woods here soon with our franchises that are now launching.
Look forward to it. And you doctors out there listening, Dr. James, we mentioned that last time. He's franchising, and we've got a number of doctors to listen to this show, so you ought to take a look at it because we got to do better than we're doing right now. Thanks again.
Oh, thank you.
Dr. Interesting guy, and a very articulate and very aggressive surgeon laying out all these alternatives. And so, look, it's a little work. I understand that. And I was insurance commissioner in the state of Louisiana for 12 years, and I understand your frustrations. But a little effort in making these comparisons and shopping around and looking at the alternatives can save you a lot of money. Because, boy, the health care costs are going. They're not going to come down any. I don't care what the Supreme Court does on Obamacare. Costs are going to go up. And so your checking around can give you some alternatives to save you some money and still get good health care. Again, those websites, my website, www.JimBrownUSA.com. Still got a lot to go on the show today. Going to come back to talk about statins right after this message. Fretting up your coffee.